Hi everyone, this is Dr. Pham here with another reaction video. Let's get right into it. This is basically my point of view when I'm doing a cavity, taking care of a cavity. This is obviously a very deep cavity, and looks like they're cleaning around the edges, which is really important as well. And there's a lot of staining. Oh, they skipped a spot there. Oh, so I'm gonna pause right at this point where they're doing the filling. Right when I noticed the dark spot in the middle, a lot of the time we want to avoid going and taking out all of the cavity right in the middle because that's where the nerve is. And we always want to avoid where the nerve is because we don't want to do a root canal. We want to avoid it. So in this video, we actually saw them cleaning around the edges. And when you clean around the edges and get that clean and you don't see any of that dark spots, that's a good sign that you've actually done a good job of getting rid of a lot of the bacteria and that's embedded in the teeth. And hopefully the deepest part of the cavity where it's sitting over the nerve, we can leave that. Based on the research, you can leave it behind and actually seal around it and starve the bacteria. At least that's what the research shows. If you go and try to remove all of that bacteria, it's already infected the nerve. It's already sitting on top of the nerve, and if you try to remove all of it, there's definitely going to need a root canal. If there's even a small chance that we can avoid a root canal, that's always preferable than going straight for it. And let's continue on with the video. So it looks like they're building up the filling. They're doing the filling now. Adding layer by layer is actually the best practice, to add small layers at a time, because then it actually has a better chance of staying sealed and there's not too much stress actually pulling on the tooth that can cause sensitivity. And at the end, they're just polishing it with some sanding discs and some polishing paste. It actually looks really nice. The anatomy is really good, and I would say that was a 9 out of 10, maybe even 10 out of 10 actually filling. The pink part that was actually around the tooth was what we call a dental dam, but that actually helps us reduce the amount of fluid that builds up, reduce the amount of water that the patient has to deal with, and overall much better experience for getting a really good filling or restoration in place. Overall, really well done. I'm really impressed by what some people are able to do. And hopefully we never have to deal with cavities that big all the time. Most of the time it's much smaller. This tooth, as the demonstration shows, is actually outside of the mouth. This is actually probably mounted in a clay model. And most likely because there was too much pain from that cavity, and that's why the tooth was extracted and used for this demonstration. Hopefully you found that interesting. Gives you a little bit of perspective on what we do every day, and hopefully you never have to deal with a cavity that size either.